you've just had a long day in the office, you've seen way too many patients, you've been talking all day, you've been pulled in 100 different directions, you're exhausted, you're hungry, all you want to do is go home to your family and friends and enjoy the rest of the night. But of course you can't, because you still have all the documentation to do from all the patients that you've seen throughout the day. You have to get into your electronic medical record, you have to dictate through Dragon or type all your notes, you have to do all the clicks and all the billing and all the data entry that we were not trained for. This is not why we got into medicine. Well, there's a new technology that aims to allow physicians to avoid all of this extra documentation time that we all hate so much. The question is it really all it's cracked up to be, or more just hype? Well, we're going to dive into a product to review today and find out. So let's go. So I know a lot of you are already using these Ambient AI Scribes in your practice, and today we're going to be diving into a specific product called Iscribe, which I've been trialing for a while. I'm a full-time orthopedic surgeon who loves the intersection of tech and medicine, and what I aim to do with this channel is allow you to practice smarter, not harder. I'm trying to find the tips and techniques that allow us to be more productive as physicians and essentially allow us more time at home with our family and friends. So what is an Ambient AI Scribe? Well, essentially what it is some sort of device, whether it be a phone, a tablet, or a computer that sits in the office while you're interacting with your patient, and it documents the patient-physician interaction and uploads that interaction into the electronic medical record. An Ambient AI Scribe is trying to solve the problem of the after-hours documentation or in-office documentation that we all need to do in order to keep up with our electronic medical records. Even when I go to the doctor, I notice that a lot of physicians have changed to doing all their documentation in front of the patient. That means you're focusing more on the computer than you are the patient. It's not necessarily why we got into medicine, right? I mean, essentially, we want to have this one-on-one interaction with the patient, listen to them, have them feel like they're being heard, and provide a treatment plan that's appropriate for them in a way that isn't blocked by the screen. And so what Ambient AI Scribes purport to do is be that scribe for you in the office that's going to take all the information from your patient interaction, upload it into the correct sections of the electronic medical record, and save you time in the long run. Today we're going to be trialing a specific product that I've been trialing over the past couple of weeks. I have no commercial relationship with this product, and I'm not promoting it in any way. Essentially what I want to do is use it as a template, because there's so many companies out there that are trying to get into this Ambient AI Scribe game. I know a lot of you are using different products, and we'll look to those in the future, but for this product we're looking at a company called Iscribe. I'm hoping this review can help you guys if you're thinking about potentially purchasing an Ambient AI Scribe software, or if you use Ambient AI software already, some tips and tricks that I can sprinkle in and hopefully help you practice smarter, not harder. Okay, as you know, here on SpeakMD, we always answer 4 questions when we're reviewing any tech product that's associated with medicine. Number 1, does it work? Number 2, will I get paid? Number 3, will I get sued? And number 4, how does it fit into my practice? So let's start this off and jump into question number 1. Does it work? Well, in short, the Ambient AI Scribe works quite well for its intended purposes. There's 2 ways that you can potentially use this Iscribe tool in order to document a patient encounter. The first of which is kind of the tried and true way, where after you come out of the room, you can use your phone where your Iscribe software lives to speech to text. Now this is similar to a Dragon or something to that effect, but the nice thing about this is you can dictate directly into your phone, directly into the section that you want to place your information into. I want to dictate physical exam, bam. Hit the physical exam button, dictate my physical exam, that goes directly into the electronic medical record in the correct section. And when you're dictating, it does use a bit of artificial intelligence in the background to make sure that what you're dictating into the program is somewhat coherent and makes sense. There is a little bit of cleanup associated with your dictation that the old school Dragon or dictating into a dictaphone wouldn't do. The second way, and the more interesting way, I think, from a technology perspective is what's called Ambient AI Scribes. Now, we all have seen scribes that sit in the office that document the patient visit when a doctor is talking to a patient. Of course, these scribes are great, but at times they are kind of hit and miss. They're employees, right? Sometimes they're good, sometimes they're not so good. Sometimes they're so good that they go off to medical school, because that's a lot of the reason why they're doing this particular job in the first place. So you have to train a new one, or you have to fire somebody that's not doing a good job, and you don't want to really get into that situation. So what iScribe does is it sits in your office, it documents the patient interaction that you're having. You ask the patient why they're coming in today. They give you information. The ambient scribe hears that, uploads that into the subject of her history of present illness. You perform your physical examination. You call out the numbers associated with what you're examining, or heart, regular rate, and rhythm. It brings that information and puts it into the physical exam section. Then you have a natural conversation with your patient about their treatment options and what the treatment plan will be, and that also gets put into the assessment and plan portion. It's a pretty amazing way to document a patient encounter, because what's interesting about using artificial intelligence is it pulls out the relevant information and leaves the extraneous information. For example, if you're chatting about your vacation, or you're chatting about the patient's vacation, or they're talking about their uncle's carcinoma or something to that effect, that stuff will be left out of the electronic medical record. Now, of course, the Ambient AI Scribe is listening to all that, but the artificial intelligence in the background extracts that information and keeps all the important information that is relevant to the diagnosis and treatment plan that you have for your patient. At the end of the day, of course, you always have the final say in how your note goes out. The Ambient AI Scribe software will not sign off on your note. The goal is to have all your notes done so that when you leave for that day, all you have to do is sign off on every note and go home. Now, does it work like that in practice? For the majority of notes, it does. But of course, there'll be some nuance that some physicians would like a specific note a specific way. Some of our medical colleagues, of course, want a more thorough note. And I think it works in those contexts as long as you have that discussion with the patient. The most important component for does it work is, does it integrate with your electronic medical record? If you're thinking about purchasing a Ambient AI Scribe software, the first question you have to ask is, does it work with my electronic medical record? For instance, does it work with Epic, to make sure that the information extracted by the AI software is being put directly into the electronic medical record. The last thing that you would want is something that just transcribes a note, and then you have to copy and paste each section into where you want it into your note. That's really not helpful, and it's really no better than a drag and dictation or something to that effect. What you want is an AI software that directly correlates to your electronic medical record, inserts everything exactly where it wants to be, so that at the end of the day, all you have to do is sign off and go forward. Question number 2, will I get paid? Of course, this is more than just will I get paid. This is, how does this fit into my billing cycle? How am I going to bill for this information? Will it save me time and money? And of course, how much does it cost? Well, first and foremost, this is a time-saving tool. So anything that saves you time can potentially increase your revenue, right? Time is money. To a certain extent, if you're spending less time documenting in your electronic medical record, you can see more patients, you can increase your revenue that way. In certain situations, it can actually increase your level of billing, because it can pull out more information from the patient encounter than maybe you can remember to put in if you're doing your notes later on that day or a couple days later. It's pretty amazing the amounts of information that you actually discuss with the patient that's super relevant and can be added in for billing, but that you don't necessarily put into your note because typing all that out would be too arduous. So what I would say is, there is a certain components of this that allow you to bill higher, because it does pull out more information from your patient encounter. One of the major things that it can do, it just helps you have a better rapport with your patients. You're not constantly looking into a computer. You're not thinking about, okay, I need to get this patient encounter done so that I can go out and document. You're actually thinking, okay, I really want to get to the bottom of what's going on with this patient. That helps patients feel heard. It really makes the connection between you and the patient better. And I think in that way, as we all know, the best referrals are from our happy patients. And so in that way, it can increase your referral base. And I think that's helpful as well too, as far as generating more revenue. This particular software can decrease your staffing needs. If you have a back office of transcriptionists, practitioners to do a lot of the initial documentation, well, that's not really needed as much anymore because the Ambient AI software listens and documents that information for you. So something that could potentially save you money is decreasing your staffing needs. Now, I know a lot of you are hospital employees, and the reason that the administrators hound you to finish your notes so much is not because they want continuity of care or they're so concerned about patient care as far as progress notes are concerned. Why do they do it? Well, the faster your notes get in, the quicker they can bill, the quicker their revenue cycle turnover, etc. And so to a certain extent, the quicker you can get your notes done, that's going to improve your chances of being paid via insurance and ensuring that your revenue cycle continues to be at a shortened time frame. Lastly, we have to talk about how much an Ambient AI Scribe can cost. Now, of course, this varies between practice and it varies between the different software providers. Some of you that are hospital employed could care less really what it costs as long as your hospital is going to provide it for you, and I can understand that. But for those of you in private practice that have to ensure that this is an appropriate use of your funds, the software itself costs per physician and per license essentially, or per provider if NPs or PAs are using this as well too. The pricing, of course, can vary, but for our particular situation, the price for the iScribe software costs $400 per provider per month, which is a lot, but you have to weigh that against the volume of patients that you're seeing and how much time you're spending on your notes. Of course, time is money, and so if you're spending less time on your notes and you can see more patients, maybe that makes sense in your practice. Okay, let's jump into question number 3. Will I get sued? Of course, this isn't about lawsuits per se, but essentially more about, is this a compliant technology? Will your patients be on board with this? What things do you need to look out for from a medical legal risk perspective? And all those things that are so important in today's practice. First and foremost, we have to understand that there's a device that's going to be listening to the patient, right? And that's a listening and recording device, and they have to be aware of that ahead of time. And so I think one of the most important things to have is a consent form, most likely in your initial paperwork, that indicates to the patient that this device will be being used. Now, from my perspective, that does weird me out a little bit if somebody says, yeah, there's going to be some device recording our patient encounter. Does that give patients a sense of unease? Does it give patients a sense of privacy issues? I would suspect yes. I think it's more important to frame your consent form in a way that lets patients know, look, we're doing this not necessarily to record you, but rather to allow the physician to interact directly with you and not be on their computer and spend more time discussing with you your actual problem as opposed to documenting information. I think that's a better way to frame the consent, and it also is important to know that this information isn't stored anywhere. It's essentially used to make a transcript of the patient encounter and then deleted. It's all HIPAA secure. So all that information is important, and if you're looking for a Ambient AI Scribe to potentially incorporate into your practice, you need to make sure that all those boxes are ticked. It has to be a reputable company that is not storing the information, that is HIPAA secure, and all the information really needs to be secure from that standpoint. Anytime you're using artificial intelligence, I know a lot of you have used ChatGPT or Gemini or something to that effect, you do have to watch out for hallucinations, right? There can be some information that the artificial intelligence puts into your note that it's a little bit erroneous, or it's trying to embellish on a certain point. Now, I haven't seen that as much with these specific software, because essentially you're not asking it questions, it's just essentially documenting your patient visit. But of course you will have to read your notes and ensure that this is exactly what you're looking for going forward. One of the other things is, I know all of us write notes different, right? As a surgeon, our notes are pretty sparse, but if you're in medicine and your notes are much more thorough, or you're a primary care physician and you want to ensure that everything's documented, the software can work for both situations, but at the end of the day, you have to have a note that you're proud of. And so for some of you, you'll be able to use this software, trial it, see if the note is something that you'd be proud of signing off on, and determine whether it's right for you. Okay, on to the last question. How does it fit into my practice? Well, first things first, this is for office-based physicians. Physicians and nurse practitioners and physician assistants that are seeing patients in the office that need to document their patient encounter. It will likely be introduced into the hospital setting going forward, but if you're a hospitalist or something to that effect, this might not be the correct software for you. Again, like we talked about in Does It Work, it's most dependent on the integration with your electronic medical record. If it does not integrate, it is not going to fit into your practice. It is not going to save you time. This particular software probably makes the most sense for high volume clinicians, people that are seeing a lot of patients in the office throughout the day. Now that's most of the providers that are probably listening to this video, but I will say that even if you're a low volume physician and not seeing a lot of patients, but still document in a very lengthy note, this can save you time because essentially all that time typing or dictating is nullified by the Ambient AI software. From my standpoint, it's really changed the way that I interact with patients for the better. I don't feel like I have to remember every specific detail associated with what happened to the patient or why they're coming in. That's all going to be documented for me. I do feel as though the rapport with my patients is much better because I'm focusing directly on them as opposed to trying to jot down notes or potentially typing in a computer. And I think the patients appreciate it as well too. I'm simply just sitting there having a conversation with them. And that's why we got into medicine in the first place, right? To be able to have a conversation with the patient, make a diagnosis, discuss treatment plan options, and move forward from there. And I think from my standpoint, I won't go back to not having this type of software. Now, that doesn't mean that this is the perfect software for everybody. And that doesn't mean that I may change this particular software to something different in the future, but Ambient AI Scribes are part of my practice going forward. I really won't change that. And the reason for that, of course, is because it's given me more free time. It's allowing me to practice smarter, not harder. I'm still seeing the same amount of patients. I'm still providing appropriate care for my patients. But what this is doing is taking out some of the data entry that is so soul crushing for us as physicians. The goal of this channel, of course, is to look at the intersection between tech and medicine and see how it helps physicians gain their time back, spend more time with their family, spend more time with their friends, spend less time in the office, because that's the thing that's going to help us get out of this burnout situation that we're in across the country. So I think this is an excellent option. It's not all the way there yet. It's not perfect yet, but it's going to continue to iterate going forward with technology. And the nice thing about artificial intelligence is it kind of learns the way you practice as well too. What are the phrases that you use? What are the phrases that you like in your record? All those things it can learn going forward, and that's really promising. It does make me optimistic about getting back to the reason why we got into medicine in the first place, which is to have an appropriate interaction with our patients, finish at the end of the day. Now we don't have to sit down and do our progress notes for the next 1 to 2 hours. We sign off our notes, we get out the door, we go home, we see our family and friends, and our day is over. I hope this review has helped some of you pick up some tips and tricks about Ambient AI Scribes. If you've had a different experience, I'd love to hear it. Negative, positive, whatever. Please leave it below in the comments because that really helps shape other people's opinions of whether they're going to get this technology or not. Well, it's been absolutely my pleasure to dive into this new technology because I learn every time I do these videos as well. I hope you got some information from it. If you're interested in the intersection between medicine and technology and how we as physicians and providers can work more productively and be more efficient in our job space and decrease the level of burnout that's occurring, please feel free to like and subscribe.